Dr. Kamara there?
Hello.
How are you?
I'm doing well. How are you?
I'm good. Oh, my pleasure. My pleasure. I tell us briefly about, so I mean, we know what you do professionally, and actually, we might want to talk a little bit about that. But as a Black woman physician, how tell us a little bit about your journey. How did you end up being Dr. Kamara?
No problem. Thank you for having me. So again, my name is Dr. Kamara, and I'm a colon and rectal surgeon. A lot of times people are like, what exactly is that? And I deal with the surgical management of diseases that impact the colon, rectum, and anus. A lot of diseases, or some diseases that this includes, are colorectal cancer, diverticulitis, rectal prolapse, constipation, hemorrhoids, anal fissures. And in clinic, I see common complaints that have to do with those diagnoses, but also bleeding from your bottom, bleeding per rectum, hemorrhoid pain, anal pain, masses or bumps that you might find around your anus. And then also sometimes having stool leakage from either your anus or from another part that you don't expect it to come out of, like one of your lady parts or your man parts. So colorectal surgery is a broad spectrum of things, from cancer to non-cancerous diseases, and then also a lot of lifestyle diseases or quality of life, things that impact your quality of life, but not necessarily will impact your length of life.
Dr. Kamara, I don't mean to be, like flippant or anything, but, when we think about people that want to go into medicine and they want to go into, they want to be a doctor, nobody thinks about the butt. So how did you end up there?
How did I end up there? That's a good question.
I mean, when was your how did you end
up? That's a good question, because people say, how did you get here? And for me, my interest in medicine, one of the big major whys for me is when I was growing up, unfortunately, my cousin got very ill and she was in the hospital. And I remember just seeing a revolving door of doctors, and these doctors were saying all these terms and terminology, and my parents and I and my aunts and uncles were just getting more and more confused, more and more anxious. So it was very important to me to become a physician that was going to also be able to impact public health. So once I knew that I wanted to be a surgeon when I was in medical school, then I went on to residency, and you go on to residency for general surgery is 5 years. And then when I got there, I said, colorectal surgery is going to give me the opportunity to be a public health surgeon. Not only am I going to get to do what I love to do, which is to operate, is to meet patients, hear what their complaints and concerns are, validate their feelings and the symptoms that they're having, and explain what we can do in the operating room to fix that. But outside of being able to operate and help my patients in that way, I wanted to be able to speak about different things that are impacting our communities, like colorectal cancer, awareness about screening, and talking about things like poop that are a very good insight of how your overall health is going. And it's a very intimate topic that people don't want to talk about. Exactly. So alarm symptoms, like when people are experiencing bleeding per rectum or changes in their stool. So for me, it was a way for me to merge both my love for surgery and also my love for public health. I want to do patient education. I'm passionate about community engagement, and I want to give my patients and communities information that empowers them in the healthcare space.
And when people come to you, I mean, it's almost as if, well, you actually, as a surgeon, you fix it, hopefully, but you're fixing a problem that may have started much earlier. And so I'm assuming, I'm not a doctor, so correct me if I'm wrong. But so as in public health, I mean, what would you tell people? I know we need to get these colon rectal screenings, right? The screenings, the colonoscopy regularly. At what point should we start doing that? I know you weren't here. We were talking about Black women in your field, but since you're here, we're going to borrow some more information from you.
No, it all goes together. And I'm really excited that, National Black Woman Physician Day falls in Black History Month. And it's really important, especially with colorectal health as well, because Black patients are more likely to develop and also die, unfortunately, from colorectal cancer. So it all, for me, is one big thing. So it all goes together. So I don't mind talking about either of those or any of those. I would say for the first part, some of these issues are longstanding issues, but then there are other things that are acute changes or changes that happened just recently. So I might have a patient that says, I always had normal bowel movements. I was having daily bowel movements, and now all of a sudden I'm seeing blood in my stool. Or now all of a sudden I'm seeing that my stools, instead of being very bulky, they're very thin. These are all signs that you might be bleeding from a mass. It could be hemorrhoids, and everyone always wants to say it's hemorrhoids, but it could be something different and deeper. So you might be bleeding from a mass. You might also have those more narrow stools because you have a mass that's pushing and making that smaller. So when you have these symptoms, I just want to encourage people to get it checked out. Let your doctor know that I'm experiencing changes. I'm experiencing these different things so that we can work you up appropriately. And when it comes to colorectal cancer screening, for people that are average risk, so you don't have any family history, you don't have any symptoms or concerns that we should increase your risk of having colorectal cancer, the recommendation is for you to get your colonoscopy at the age of 45. And especially in the Black community, there are a lot of people that do not want to get their colonoscopy. They fear getting a colonoscopy,
but they hate taking that Medicare. I'm speaking for myself now.
Yeah.
When are you all going to come up with something where you don't have to take that stuff for like 24 hours or some other way to clean out your colon? What can we do?
It's important to clean out your colon because we want to be able to see the lining of your colon wall and make sure we're not missing any masses, polyps, or other lesions. People hate the prep. That is the worst part of actually getting a colonoscopy. The actual procedure is less than 30 minutes. You're in and you're out, and it's relatively painless, and the risks are minimal. But when it comes to the prep, that's the issue. So now there are different types of preps. You can ask your doctor to give you something besides. Usually we have something that's called Go Lightly, and that's 4 liters that you have to drink, and it completely cleans out your system. But we also now have different things like that. You can take it with tablets if you prefer to take some pills. And they're also making new preparations that are smaller volumes that you have to drink. But we need to clean out that whole colon, because that's the way that if there are polyps that are precancerous lesions, we can take out some of those.
Right. Well, thank you. I feel better now because it's that time for me. So I'm like, God, do I really have to do that? And I'm sure everybody I've talked to always, you hear it.
Yes.
It.
So I hear it every day. But I will still encourage you, because not only is it diagnostic, so if there is cancer there, and you diagnose it immediately, but it's preventive. When there are precancerous polyps, we can remove those polyps. Sometimes we have to do that in multiple procedures, but we can remove it before it becomes cancer. So that is the benefit. Not only are we diagnosing, but we're also doing preventive measures. And that's different than if you do the Cologuard, where you just poop in a box and then we test it for blood and DNA. That is only basically a diagnosis. It can't prevent. You can't take out a polyp with the Cologuard.
Right. Well, I mean, we're going over, and that's okay, because I really want you to talk a little bit about, this field that you're in, and, what the representation is of Black women in this field. And so, tell us, I mean, are you one in an ocean of, plenty, or are there more Black women now who are pursuing medicine? What's happening
So National Black Women Physicians Day basically commemorates the first woman physician in the United States. And that's Dr. Rebecca Lee Crumpler, and she got her medical degree in 1864. Wow. And it is amazing, because now when we look back, we still do not have, we're highly underrepresented in medicine. Only 3% of physicians are Black women. So not only are we happy for the representation that we currently have, but it's a time where we can really talk about how we can break down those barriers and encourage other people to pursue a career in medicine. I think one of the main things is sometimes people just don't see it. Representation matters, because when you see someone doing something, you're like, I can be that. That is possible for me. So my recommendation, and what I tell people all the time, is look for mentors. In today's day and age, with social media, you can basically find a mentor anywhere. So when I was interested in colorectal surgery, I didn't have any mentors that looked like me. But then I got on LinkedIn, and I literally would cold email different colorectal surgeons until I found mentors who were willing to mentor me, willing to work with me. And I was able to achieve this career. So it's about finding mentorship. There's a lot of work that can be done when it comes to representation in this field. And we are so needed, because our patients need us.
I think the other barrier for some is, the fear of medical school costs, not just the time, but the cost. And so, has anything, or are you finding that there are greater resources for those who want to pursue medicine, particularly women, to help support them through their education and training?
I will say it is a very expensive process.
Hmm.
As a first generation physician myself, first in my family, it is very pricey, not only to pay for your tuition, but to pay for your books, to pay for the exams, and then to pay for the preparation materials that are necessary to prepare for those exams. So I would say the resources, unfortunately, I wouldn't, there are some. So there are different scholarships that are available, but a lot of times, many of us are having other jobs, taking out extra loans, and putting ourselves in sometimes a poor financial situation in order to achieve this dream. So that is actually one of the major barriers, is just the access. When I think about it, if an exam just to help me get to the next level costs $1,500, not everybody has $1,500 or someone that can borrow them that money in order to make it to get to that level. And that in itself financially is a barrier.
Yeah, but you persevered, thank goodness, and now
Yes,
you're waving the flag and saying, "Come on, let's join because of the need."
absolutely.
3% is a sad number, although I assume that a lot of those are still coming from our traditional schools like Howard University, and where else are our medical schools producing more physicians?
I would say HBCUs definitely have the highest number of producing Black physicians.
Mhm.
But at all of the other institutions as well, like I trained at my medical school was Michigan State University.
Okay.
And then I went on to do my residency at Detroit Medical Center, Wayne State University. And while these are not historically Black colleges or universities, they I went there and I thrived. And once you get into these institutions, it's important to build your network. And your network doesn't always have to look like you. Your network has to be diverse in itself. Just like we are promoting diversity in medicine, you should also promote diversity in the network, in your mentors, because that's going to give you perspective and insight. There are things, sometimes I feel like the greatest barrier for Black and Brown medical students or anybody in medical training is that we don't even know the playbook.
Mm.
They are
Mhm.
playing by rules that we're not privy to. So to learn the playbook, you have to get to know them, get to know other people, and learn what it is that you need to learn and how to succeed, how to win. So I say that's by getting mentorship, that's by buying books, that is by meeting as many people as you can and speaking to them about how they got to where they are.
We talk a lot about food deserts. And I'm sure we have medical deserts as well, places in the country where people just don't have access, quick access to doctors or to medical care. Are there any initiatives out there that you're aware of where, if a person did pursue, a medical degree, that if they commit maybe to work in certain areas or I mean, are there programs like that that
Yes,
help to
definitely.
fulfill those voids? Hmm.
Yep, there definitely are. So, especially when it comes to loan forgiveness and repayment options, if you work in certain areas that are more underserved, then you do have access to those types of uh, those types of payments or benefits for
Right,
being in an underserved area.
right. And I guess the last question I would ask is that we have a new sheriff in town or coming that's going to be over Health and Human Services. What are the Black women in medicine or Black physicians, Black women physicians expecting as an outcome of some of the new policies that may impact patients around the country? I know that we are talking about obesity as an issue, which I think probably has an impact on the type of medicine that you practice, you know, and you know, nutrition issues and what have you. I mean, what are you all advocating now for patients to be healthier? Besides, in addition to the testing, you know, that you may do, but what else would you advise communities or individuals to do to ensure more quality health for themselves?
Yes, I think quality health for yourself, especially when it comes to colorectal health, I'll speak on that first, is a lot of lifestyle changes can be made. So you're going to watch your weight, you're going to increase your physical activity. And then when it comes to your diet, you really want to be privy to how much fiber, especially you're getting in your diet. The American diet is very low in fiber. Low fiber, red meats, those things are associated with increased risk of getting colorectal cancer. So everybody should be getting 25 to 30 grams of fiber. Look at your nutrition labels. See how much fiber you're getting. Take a fiber supplement. Metamucil, Benefiber, Citrusel. Those things help you to increase your fiber in your diet. Make sure that you're drinking enough water, 60 to 80 ounces of water a day. These are things and changes that you can make in your daily life. But then I want to encourage everyone, establish care with a primary care physician or provider. When you're establishing care, you are letting them know, hey, I'm here. And these are what is happening with my body. And sometimes the things that you think and have accepted as normal are not normal. They're very far from it. So you need to make sure you are talking to a medical provider so they can tell you, actually, what you're describing there is something that we need to work up further. And it could indicate X, Y, or Z, and we need to look into it further. So those are the things that I think that everybody at a baseline, at an individual level, you can do. Despite what might be happening around us with different policy changes, this is how that you can empower yourself and take charge of your own health so that when you enter into a medical space, you have certain things that you've already done. And the other thing I want to tell people, know your medical history. Know what medications you take. Know what family history you have of different diseases, including cancerous and non-cancerous things. When you enter into your appointment, you want to have that information. You want to know that information because information is power. What you know can help us to diagnose and figure out what is happening with your body. So I just want everybody to know that you can take control. You can understand better what is happening, but we just need to do the small things on our daily basis to help positively impact our health.
If I can add to that, Dr. Kamara, because you know, there's that group of people called patient, advocates and caretakers. And sometimes that patient caregivers, I'm sorry, yes, Shevry just corrected me, not caretakers, but caregivers. Yes, we don't want to go to the caretaker because then it's too late. But caregivers who can be that person who can answer those questions just in case you can't. Exactly. Because, you know, there are times when people go into a hospital, they're just not, they know they have this information, but they have it and they can't communicate that. So would you advise that, you know, they have a person, a family member or what have you, that has access to your not your entire medical record, but I mean, what would you advise? Let me just put it that way.
So my advice on that is a couple things. Number one, you can carry it on you. So you can write it down on a card and put it in your wallet. So you always have your medical history. And when people ask, you just provide it. There you go. That's my medical history. These are the medications that I'm taking. These are the surgeries that I had. And these are my family history. Another thing is if you don't want to have a physical card, you can put this in use your notes app. And in your notes app, write down your medications, how often you're taking them, your doctors, the surgeries that you've had, all those things, so that even if you are not feeling well, you can say, you know, I have this note app that I've pinned right here, and you can just look at my medical information there. And then, yes, always make sure that you have an emergency contact, someone that has the basic information, even if they don't have all of the details, but the basic information that can help us diagnose. When we're making a diagnosis for you, all of that past history is very important. That plays into where you are right now. So I know sometimes when people come to see us, they get a little bit frustrated. Like, it should be in my chart. It should be, and it might. I
was going to ask that question too, right?
Yes, but when you say it and we have an open discussion about it, that's really when you're getting the best care.
Okay. Well, I want to thank you so much for being with us today. I want to help you to celebrate and others National Black Women Physicians Day, which is tomorrow.
Yes.
And so tell us, how do you plan to observe that day? And is there something the rest of us can do to help all of these Black women physicians observe that day?
I would just say thank the Black women physicians. You can thank them online. Social media, I feel like, is the big space where you can actually see more Black women physicians than you might see on your daily life. So, number one, thank them online. Just a thank you to physicians for the things, the positive impact that we have had on your life. And then for me personally, I do have a very strong group of Black women that I trained with, either in medical school or residency, and even in fellowship, who I just have this community. So we celebrate each other. And you can see more actually on my social media page. So you can follow my Instagram at Dr. Kamara. And I'll be posting there and posting some fun reels that me and my friends made, just to raise awareness that we are here to listen, and we are here to empower our communities.
Wonderful. Dr. Kamar, thank you so very much for being with us. Thank you for selecting medicine as your career. It sounds like you wear it well, and looks like you wear it well. So we appreciate all the advice that you've given us today, and hopefully we will take heed.
Okay, well, thank you so much for having me, Denise. I'm happy to share, and I look forward to celebrating National Black Women Physicians Day tomorrow.
All right. Okay. Thank you. Take care.
Thank you. Bye.
All righty.